Hello and welcome to the program. I'm Yomi Otaigbe. It's good to have you with us. Medical laboratory testing plays a crucial role in the detection, diagnosis and treatment of disease in patients. But why is it that this important means of determining the possible changes in the health status of patients is sometimes bypassed? In the course of the program, I'll be speaking with a medical laboratory scientist on these and other issues around medical laboratory services. The medical team from the United States filing in. Their counterparts from the Delta State University Teaching Hospital also ready for the big day. The state's governor, Dr. Emmanuel Duaghan, is equally here to see to the success of the first kidney transplant in the state.
The recipient is a little more involved. That surgery takes 2.5 to 3 hours. That patient has to be monitored for about a week in the hospital to make sure there's no signs of rejection, make sure the kidney is functioning well, make sure the drug levels are adequate. And then he or she will go home about 5-7 days after surgery and will come back to the hospital 2 or 3 times a week for monitoring our laboratories and exam and so on and so forth.
The first patient is a mother donating one of her kidneys to her son. After about 2 hours for the donor surgery, the left kidney has been harvested and is being preserved in this ice pack for onward transplantation to the recipient. The 23-year-old recipient, who's been prepared for the surgery, now receives the donated kidney in an operation that lasted about 2.5 hours.
Now, kidney cases are becoming very rampant, and a lot of our people go outside Nigeria for treatment for such cases. And what we have done here really is to get this place equipped and also partner with University in America that will ensure that from time to time we are able to manage the cases here. The significant thing about this, what we are doing is that it makes it cheaper for the patients. Averagely, from what I've discussed with the MD, it costs about 1.5 to 2 million naira.
With the Delta State University Teaching Hospital, Ugara joining a list of the few public hospitals that provide kidney transplant services in Nigeria, patients who may be thinking of traveling abroad now have homemade options. Now let's see all the stories making the rounds.
The World Health Organization has certified Nigeria as a guinea worm-free country. The cheering news was broken by President Goodluck Jonathan while declaring open the first Federal Executive Council meeting in the year at the presidential villa. The president said that this certification is an indication of the hard work the government and other authorities concerned have put in and promised to continue the effort to eradicate other diseases.
The certification by WHO is a global recognition of how far we have come and the success of the work that has been done to rid our country of this scourge. Eradication of guinea worm disease that has long plagued many parts of our country has placed intolerable burden on our citizens. And as a government, we've been working very hard, and today we have received the good news. Just as we have fought the incidence of guinea worm disease and succeeded, so are we committed in our fight against many pandemic diseases such as HIV/AIDS, malaria, and tuberculosis, and of course, polio.
As part of efforts to organize Nigeria's chaotic drug distribution network, a mega drug distribution center would soon be commissioned in Onitsha, the Anambra State capital. At a meeting in Lagos organized to enlighten drug manufacturers, importers, distributors and healthcare professionals on how the center will operate, the Director General of NAFDAC, Dr. Paul Ohi, explained that the mega drug distribution center would be replicated around the country to enhance access to quality and safe medicines.
Of course, you will have an ABDAC official there who will be checking the quality of the medicines coming in using our tool scan and other equipment before the medicines are stocked. If the way we envision is that it will be like the Ekiti State Drug Distribution Center. What I saw there was very impressive. They have qualified pharmacies that have managed the center. The temperature is controlled. They have a good warehouse. That medicines are appropriately stored, and they have good record. Medicines that were sold from that center 3 years ago, they can still trace and tell you where the medicines were sold, in what quantities, and where they are likely to be distributed. So that if there is a problem and you need record, if you need any information about the medicine, you can easily find out where that medicine is. And I've been going around the country trying to encourage other state governments to do the same, what the KTG has done. You also can go and see what the MTS has in Abuja and in Kano. Temperature is controlled, and everything is done according to the best production practices.
India has reached a significant milestone by being polio-free for 3 years. This remarkable feat was made possible by the combined immunization and awareness campaign efforts of the Indian government, international organizations, local NGOs and other groups. According to the World Health Organization, India was the largest endemic reservoir of polio in the world between 1978 and 1995, with as many as 50,000 to 100,000 paralytic polio cases occurring each year. It has also been a major source of transfer of polio to other countries.
India accounted for over half of the global polio burden, and today is the historic day when we have completed 3 years without a single case of wild polio. This monumental milestone was made possible due to unwavering political will at the highest level, commitment of adequate financial resources, technological innovations like use of bivalent vaccine, and tireless efforts of millions of workers.
Polio is an acute viral infectious disease spread from person to person, primarily by the fecal-oral route. A chemical spill into the Elk River in Charleston, West Virginia, has prompted the governor of the state, Earl Ray Tomblin, to declare a state of emergency and water ban in 9 different counties. The pronouncement came after a notice put out by the West Virginia America Water Company informed the public that its water supply had become contaminated.
Devastating. My employees cannot work. We can't serve the public any food. I've turned away about 80 customers this morning already. The health department says we have to have a way for people to wash their hands. So this is what we did. We come in, you can wash your hands, and this is what we got to do. And myself, I have no shower, shave 3 days now.
As may be expected, the incident has slowed down business, but the government has attempted to alleviate the situation by providing bottled water for drinking as well as energy drinks.
Right now, the supplies go, we're giving 1 case of small bottles, 3-gallon bottles, or 3-gallon jugs, and then energy drink.
It is not yet clear when the water supply will be restored. Thick air pollution that has soared to the highest levels in months has become a source of concern for residents of Beijing, the capital of China. Some citizens have been seen wearing protective masks.
In the morning, I checked the air pollution level, and today it said the air pollution is very serious, so I wore my face mask. In terms of the effect on me, personally, I have nasal inflammation, and today it's really bad. Often, I worry that the air pollution is harming me.
Chinese authorities have made known a new smog alert system that will require curbs on driving and will stop manufacturing and construction if 3 days of the hazardous pollution are forecast, but this doctor has had enough.
The pollution is really bad. Recently, I've had a bad cold all the time, have difficulty breathing, and the film that I cough up is black. I'm planning to leave Beijing. I don't want to stay here.
China has some of the world's most populated cities, and hazardous levels of pollution are nothing new to Beijing. A new blood test has been developed by a team of researchers in Florida, which may diagnose patients who are at high risk of developing heart attacks. The new HD-CEC test spots endothelial cells in the blood circulation. The test is based on the fact that clogged arteries, which are a precursor to heart attacks, release surrounding endothelial cells into the bloodstream when the plaque in them ruptures. Results from the study show that blood samples of healthy subjects contain fewer than 1 endothelial cell per millimeter of blood, but those who had just suffered a heart attack had more than 20 endothelial cells in 1 millimeter of blood.